A stroke happens every 10 minutes in Canada, and strokes are occurring now in younger and younger people. Health specialist Leah Sarich here this morning at Stroke Awareness Month. Calgary leading the world, Leah, when it comes to stroke care.
Isn't that amazing?
That is great.
I was just telling you before we came up, I've been interviewing Dr. Hill for 10 years, and the advances they have made in this last decade are very, very exciting.
That's great to hear.
So first off, you don't really want to ever have a stroke. This is what Dr. Hill says. But if you're going to have one, Calgary and really the province of Alberta, good place to have one. You're going to get great care here. In fact, a new report from the Heart and Stroke Foundation shows Alberta has the lowest death rate in the country for stroke. So this is exciting. So it's all about recognizing the symptoms of stroke and getting the care that you need as quickly as possible. So let's tell everybody what those stroke symptoms are. So basically, we're talking about three main symptoms. So it's a sudden loss of speech.
Like suddenly?
Suddenly, like that. Sudden paralysis on one side, so you can't lift your arm on one side, that kind of thing. Sudden vision loss, again, usually on one side. So those are the three cardinal symptoms of a stroke.
Those are big-time red flags.
Big time, huge. Those are the big ones right there. Smaller symptoms that can also happen, a really bad headache, really, really fast again, and also being off balance suddenly, really, really quickly. So those are the big stroke symptoms. And you really want to be able to recognize them just as in the general public, because if you're in fact having the stroke yourself, you're not going to be able to call for 911. You're going to be incapacitated. So we need to be able to recognize that in everybody else. So everybody needs to know these stroke symptoms. And then what you want to do is when you call that 911 right away, you need to tell them, I think this person is having a stroke.
A successful treatment depends on speed. When you have a blocked artery in the brain doesn't tolerate that for very long. If you can get to our group here within an hour or so, we can often do something about it and you'll walk out of hospital. If it takes 4 or 5 hours, the chances of you walking out are pretty slim, right? You'll need rehabilitation and you may not even survive. So you got to be quick. So
you got to be quick.
And you got to say, I think this person is having a stroke.
Yes, because then what happens is that alerts everybody at Foothills to say, okay, we've got a stroke guy coming in, and they're going to get you in what they call the stroke pathway.
Oh, great.
So that just gets you moving right through the hospital and through all the systems as quickly as possible. So this is really good. So it's the best way to get the care that you need quickly. So it's all about restoring blood flow. So basically, the most common kind of stroke is a blockage in the brain. And basically, they call it a plumbing problem. It's like having a clogged drain in your kitchen sink. And they basically, and Dr. Hill calls it, they have human Drano. They have human Drano. It's called TPA. So it's a wonderful clot-busting drug, and it works really well on small and moderate-sized clots. For the bigger clots, they're actually doing a study right here in Calgary, and I'll, of course, bring you those results. But they're looking right now what to do about these bigger clots. What's the best treatment option? So they're looking, is it TPA? Is it in combination with something else, like a stent or an angioplasty or opening up that artery with a catheter, that kind of thing. So that's what they're looking at right now.
When it comes to care, what makes Calgary so good?
Yeah, so that's the big question I asked. So, you've got this recognition all over the world. What is happening? And he said basically it's about relationships and speed.
We've been able to develop a real team infrastructure here, and we work well and fast together. So the acute stroke side has been dominated by speed, and we have a terrific relationship with our emergency physicians, with the paramedics, with our imaging colleagues in radiology. So we're routinely treating people within 30 minutes that they arrive at hospital, and there's few places in the world that do that routinely.
Treating people within 30 minutes?
Yes, of arrival at the hospital.
That is fast.
Yeah, so that is world-class care that's happening right here in Calgary. So that's great. So it is wonderful, of course, that we have such great care here in Calgary, but we, again, do not want to avoid we don't want to have a stroke. So best ways to prevent the stroke, let's revisit that. Watch your blood pressure. That is the #1 biggest risk factor for stroke, high blood pressure. So make sure you keep that blood pressure down. Exercising. Dr. Hill says humans are built to move, so we got to move to live. That's the bottom line right there. And then, of course, watch your salt intake.
Sodium.
Because that affects your blood pressure.
Hidden sodium, too.
Hidden sodium. It is. You really got to look. Yeah.